Hey everyone! Welcome back to our channel, where we dive deep into the most intriguing books and ideas. Today, we're summarizing a highly insightful book on cognitive behavioral therapy, CBT. Whether you're dealing with depression, anxiety, or other mental health issues, this practical guide can help you understand and apply CBT techniques to improve your well-being. So, let's get started and explore the transformative power of CBT. Cognitive Behavioral Therapy, a practical guide to CBT for overcoming depression, anxiety, and other mental health issues, is a comprehensive introduction to the principles and practices of CBT. This book is designed to be accessible to both newcomers and those familiar with CBT, providing valuable insights and practical techniques for managing mental health challenges. Cognitive behavioral therapy is a form of psychotherapy that focuses on identifying and changing negative thought patterns and behaviors. The book breaks down CBT into several key components, each of which plays a crucial role in helping individuals overcome mental health issues. Throughout the book, the authors provide detailed explanations, real-life examples, and step-by-step exercises to help readers apply CBT techniques in their own lives. In the first part of the book, the authors introduce the fundamental concepts of CBT. They explain that CBT is based on the idea that our thoughts, feelings, and behaviors are interconnected. By identifying and challenging negative thought patterns, we can change our emotions and behaviors for the better. The book emphasizes the importance of recognizing cognitive distortions, which are irrational or biased ways of thinking that contribute to negative emotions. Common cognitive distortions include all-or-nothing thinking, overgeneralization, and catastrophizing. By becoming aware of these distortions, we can begin to challenge and replace them with more balanced and rational thoughts. Part 2 focuses on identifying negative thought patterns. The authors provide practical techniques for recognizing and recording negative thoughts, such as keeping a thought diary. This involves writing down your thoughts, emotions, and behaviors in specific situations to identify patterns and triggers. The book also introduces the concept of automatic thoughts, which are immediate and involuntary reactions to situations. These thoughts often go unnoticed but can have a significant impact on our emotions and behaviors. By bringing automatic thoughts to our conscious awareness, we can begin to challenge and change them. In Part 3, the authors delve into techniques for challenging negative thoughts. One of the key strategies is cognitive restructuring, which involves questioning the validity of negative thoughts and replacing them with more balanced and realistic ones. The book provides practical exercises for cognitive restructuring, such as examining the evidence for and against a negative thought, considering alternative explanations, and evaluating the consequences of holding on to a negative belief. By systematically challenging negative thoughts, we can reduce their impact on our emotions and behaviors. Part 4 explores behavioral techniques used in CBT, including behavioral activation and exposure therapy. Behavioral activation involves engaging in activities that bring a sense of accomplishment and pleasure, which can help improve mood and reduce depression. The book provides practical tips for identifying and scheduling activities that align with your values and interests. By gradually increasing engagement in positive activities, you can break the cycle of avoidance and inactivity that often accompanies depression. Exposure therapy is another powerful technique discussed in the book. It involves gradually confronting feared situations or objects in a controlled and systematic way. This helps reduce anxiety and fear responses over time. The authors provide step-by-step guidelines for creating an exposure hierarchy, which is a list of feared situations ranked by difficulty. By starting with less challenging situations and gradually working up to more difficult ones, you can build confidence and reduce anxiety. In Part 6, the authors introduce mindfulness and relaxation techniques as complementary practices to CBT. Mindfulness involves paying attention to the present moment without judgment, which can help reduce stress and improve emotional regulation. The book provides practical exercises for incorporating mindfulness into your daily routine, such as mindful breathing, body scans, and mindful eating. Relaxation techniques, such as progressive muscle relaxation and guided imagery, are also discussed as effective ways to reduce tension and promote a sense of calm. Part 7 focuses on applying CBT techniques to specific mental health issues, such as depression, anxiety, panic attacks, and phobias. The authors provide tailored strategies and exercises for addressing these conditions using CBT principles. For example, the book discusses how to use CBT to challenge negative beliefs associated with depression, manage physical symptoms of anxiety, and confront feared situations in cases of panic disorder and phobias. By applying these techniques, individuals can develop effective coping strategies and improve their overall mental health. In the final part of the book, the authors discuss strategies for maintaining progress and preventing relapse. They emphasize the importance of ongoing practice and reinforcement of CBT techniques to sustain improvements over time. The book provides practical tips for creating a relapse prevention plan, such as identifying early warning signs, developing a support network, and continuing to challenge negative thoughts and behaviors. By staying vigilant and proactive, individuals can maintain their gains and prevent setbacks. So, what are the key takeaways from Cognitive Behavioral Therapy? A practical guide to CBT for overcoming depression, anxiety, and other mental health issues. 1. Understand CBT. Recognize that CBT is based on the idea that our thoughts, feelings, and behaviors are interconnected. By changing negative thought patterns, we can improve our emotions and behaviors. 2. Identify negative thoughts. Use techniques like thought diaries to recognize and record negative thoughts. Bring automatic thoughts to conscious awareness to begin challenging them. 3. Challenge negative thoughts. Employ cognitive restructuring techniques to question and replace negative thoughts with more balanced and realistic ones. 4. Engage in behavioral activation. Identify and schedule activities that bring a sense of accomplishment and pleasure. Gradually increase engagement in positive activities to improve mood. 5. Use exposure therapy. Confront feared situations or objects in a controlled and systematic way to reduce anxiety and fear responses. 6. Incorporate mindfulness and relaxation. Practice mindfulness and relaxation techniques to reduce stress and improve emotional regulation. 7. Apply CBT to specific issues. Tailor CBT techniques to address specific mental health issues, such as depression, anxiety, panic attacks, and phobias. 8. Maintain progress. Develop a relapse prevention plan and continue practicing CBT techniques to sustain improvements and prevent setbacks. Cognitive Behavioral Therapy. A practical guide to CBT for overcoming depression, anxiety, and other mental health issues, is an invaluable resource for anyone looking to understand and apply CBT techniques to improve their mental health. By following the practical advice and exercises provided in the book, you can develop effective coping strategies and achieve lasting positive change. If you're interested in learning more about CBT and how it can help you overcome mental health challenges, this book is a must-read. Thanks for watching, everyone. If you enjoyed this summary, make sure to like, comment, and subscribe. Let us know in the comments what book you'd like us to cover next. And remember, the power to change your thoughts and improve your life is within your reach. See you next time.